So, myasthenia gravis, which is very big on NCLEX, is a disease, right? That is a muscle weakness disease, but the reason it causes muscle weakness because it has something to do with the chlorinase that these links are producing. Ready? Myasthenia gravis is a neuromuscular disease that is characterized considerable weakness and abnormal fatigue of the voluntary muscle. The defect of the transmission nerve impulses is at the junction, myoneural junction occurs. It causes an insufficient of chlorine. So it produces tons of chlorinase. So the medication we give you is an anti-chlorinase. Where, Miss Sonia? At the junction. These are the junctions. There we go with the phones. Right? These are the junctions. Now, last week, I said that the neurons have myelin sheath, the voile, right? This disease has nothing to do with the myelin sheath. The problem is this is producing too much chlorinase, the junction. So therefore, we're going to give you anti-chlorinase. Now, the muscle weakness happened from head to chest. Guillain-Barré was not a junction problem. Guillain-Barré was the myelin sheath broke down and went to the blood and caused infection that caused you to have muscle weakness from feet to chest. But myasthenia gravis is muscle weakness from head to chest. So if I say muscle weakness from head to chest, early sign I will have eye problem, chewing problem, difficulty swallowing, and then eventually it goes to respiration. It will never go to feet because by the time you go to feet, you're dead. Any question with myasthenia gravis? Now, with myasthenia gravis, I cannot give you medication too early or too late, too much or too little. Again, I cannot give you medication too early or too late, too much or too little. Now, you will never get better. It's like having AIDS. You will eventually die, but you ain't gonna die tomorrow. It's manageable. Now, if you go deep in patho, what gland caused this to occur? And it is called the thymus gland. Thymus, T-H-Y-M-U-S. Now, with this disease, I can ask you several questions. Now, I can ask you, and I'll put them in order so you could know. Myasthenia gravis question. I can ask you the medication question, or I can ask you nursing intervention for the disease. You got that? And where I get you is, sometimes I ask you about the disease, you give me this. You must know when I'm asking you this, this, or this. Now, let's talk about the disease first. So, I told you what is the disease description. A, so you will read that. B, sign and symptoms or data collection, weakness, fatigue, difficulty swallowing, dysphagia, ptosis, diplopia, all of this. Now, nursing intervention for the disease is C. So far, I gave you this and this. Any question? Now, let's talk about the medication for this disease. There is 3 medications that they give, and we're on the same page. The medication is on the page, right? I am on page 826. You see where it says anti-chlorinase medication? Yeah. There is Prostagemin, Mestinon, Tensilon. That's the medication. So far I did this, and now I'm here. Miss Sonia said you cannot give too much or too little, too late or too early. Keep that in mind. When we give the medication, we cannot give it on empty stomach because it causes GI problems. So let's see. The medication side effects. Now remember, that's not the disease side effects. The medication side effect is sweating, salivation, nausea, diarrhea, bradycardia, hypotension. So, a person who have myasthenia gravis and is on medication, how would you position them? Look, look, look. Side effect. How would you position this patient? Side or what? High. Why? Because of the what? Salivation. Stay with me, right? Now, when you give myasthenia gravis drugs, disease, I already did this. I'm talking about myasthenia gravis drugs. When you give it the drugs, you will give it on time, administer medication before meals with milk, with food, monitor muscle strength, note the crisis, have antidote. Right there. Stay with me. Stay with me. Miss Sonia said you cannot give the drug too much or too little. If you give too little, so the doctor orders 600 milligrams and you give 200 milligrams, the patient go into a crisis called myasthenic crisis. Now, the sign and symptoms of myasthenia crisis, this has nothing to do with the disease. This is where I get you on the test. I'm asking you questions on the medication. You go give me disease. I didn't go there with you. So let's go to sign and symptoms of myasthenia crisis. Ready? There you go. High pulse, high respiration, and blood pressure. Respiratory distress, bowel and bladder incontinence, decreased urine output, absent cough and swallow reflex. So, you see that? Oh, bon Dieu. NCLEX asks you, for patient, which patient you going to see first? I didn't put myasthenia crisis. I'm going to put the drug. A patient who's complaining they on nitroglycerin, who's complaining of chest pain. A patient who's on tensilin. Well, stay with me. A patient who has COPD need their bronchodilator, or a patient crying for pain. Which patient you going to see first? I did not put myasthenia gravis. What did I put? Because I know if I give too little, that will put that patient in respiratory distress. This is how NCLEX get you, not what you see in the book. So, est-ce que nous comprenons? You see that? I did not put myasthenia gravis. I did not put myasthenia crisis. All I did was gave you the drug. And I'm finished with you. So if you don't understand who, you see that? Guys, they will not give you what's in the book. Please, they will not give you what's in the book. They will give you half. And it's you that do the critical thinking. You know, when you are on tensilin, it's a myasthenia gravis drug. You cannot give too much, too little. When I give too little, the patient go into respiratory. So right there, Maslow say, what's priority? Air. Wait. There go your test. That's how they give it to you. You see that? Who did not understand that? If you ain't understand that, there you go. I know y'all don't like when I'm negative, but no problem now. Right? So make sure we understand that. Now, so that is called myasthenia crisis. Right? Now, chlornergic crisis. Yes.
How you know you give too much?
I'm going to tell you that. You got to wait. In pieces. Right? Now, chlornergic crisis, you gave too much. So if myasthenia crisis, everything high, chlornergic crisis, everything low. When you give too much, you will give an antidote called atropine. Where did Miss Sonia teach you atropine? Med-surg cardio. What did I tell you atropine used for? Low heart rate. So when you have chlornergic crisis, your heart rate is low. When you give atropine, your heart rate is high. So anytime a patient is in chlornergic crisis, and you give them atropine, which vital is essential? Heart rate. Any question? Now, my darling, say.
I have a question.
Yes.
You said about the atropine, when you give it, it will increase the heart rate?
Yes.
Okay.
Because atropine is given for bradycardia. And when you have chlornergic crisis, you're bradycardia. So when I give you the atropine, I need to watch heart rate so the heart rate don't go into VT. It's going to make your heart rate go up. But how fast though? We don't want the patient to go into VTAC. Heart rate 150, 200, 250, 300. We don't want you to die. We cool. Now, my girls ask, how do you know if you give too much, too little? Here it is. Watch. I got 2 patients in front of me. Ma'am, you can sit. Yes, Shazwood. Is a chair there, right here. Raise your hand, darling, so she can see there's a chair there. Okay, so now, here's the most important part of the lecture. What she asked. Miss Sonia told you it was 3 drugs. Mescaline, Tensilon, Prostagen. True? Mm-hmm. Now, this is Susan. I know Susan has the disease. I know. Susan is a Myasthenia gravis patient. My lady, what is your name? Watima. You African, Watima? No. You Haitian? Oh. Watima. Want to know, do she have the disease? 2 different things. Susan got the disease. We know that. We already did the test. Watima don't know. We trying to see if she have the disease. Mm-hmm. Now, Susan come to the office. We already know she have the disease. So we're not trying to find out if she have it. But I want to know how she been taking her medication. I want to know if she is in Myasthenia crisis or Chlornergic crisis, because I know she got the disease. So we're going to inject her with what we call Tensilon. Susan, because we know Susan got the disease, but now we want to know how Susan control her medication. Do she give it too late? Did she give too little? We want to know. So here's Susan. Ready? Book. Let's go. Because Susan is number 3. Susan is number 3. So Susan, I want you to put number 3, put Susan, so you can remember. When you go to NCLEX, just put Susan. We already know Susan got the disease. All we want to know how Susan been taking her medication. Y'all with me? Now, number 3. To differentiate whether Susan have Myasthenia crisis or Chlornergic crisis, here's number 3, Susan. We're going to inject her with Tensilon. If her weakness get more severe, Susan is what? She over medicate herself. If when I stick her, Susan got better, Susan is in which crisis? Myasthenia crisis. So if when I stick her, her muscle weakness is more severe, I'm going to give her what? Atropine. Any question? So I say Susan. Susan, number 3, you should put Susan. Now, number 2, you remember, this lady been having muscle weakness. All she want to know if she have this disease. Watima, she just muscle weakness. I can't see. This and that. Okay? She came in. We're going to stick her with Tensilon, which is an injection. Her. Now, to diagnose Myasthenia gravis, we're going to give her the Tensilon, the injection. If she have the disease, positive for Myasthenia gravis, she will show improvement when you stick her. If she don't have it, when I stick her, it will get worse. No, not Chlornergic. Don't go there. Don't go. Hey, don't go there. I separated too pretty for you. I want to know if she have this disease. So why you going Chlornergic Crisis? Don't mix up the stuff. Susan was either Chlornergic or Myasthenic Crisis. Her, we just want to know if she have it. Bombeyo bien, eh. 2. So Watima is number 2. Susan is number 3. See, it took me 15 minutes for this. Now, you see Tensilin, NCLEX don't put Tensilin. They put the E1. Indofornorm. You see that long ass word? That's what they put. Well, so you remember, each drugs, you need to know brand and generic. And I don't care, I can put Indofar whatever. You should know what I'm talking about. Or they get funky with it, baby. They put antichlorinase. Bingo. That's the class. You must know the drug. I can give it to you. Indofar. I can say Tensilin. Or I can say antichlorinase. Or I can put the disease, Myasthenia gravis, whatever Dave Pearson decides to have. Any question? You see this? If you don't know this, don't go open. Now, you remember Miss Sonia told you the thymus gland patho? If you go read this in the patho book, they think it has to do with the thymus gland. They will remove it. They will do a thymonectomy to remove it. And guess what? It's still gonna work. I have a student that have this, that went to NCLEX. Because when you have this disease, she worked, she a PA. One of my PA students in the school, she had this. She worked just as pretty can be. She had this Pearson, it's a disability, so her test was longer. Instead of 6 hours, her test was 8 hours because she have a card. She have a card indicating she have a disability. When she went to take her implant, she had to take breaks. Remember, she got muscle weakness from head to chest, so it was time that her eyesight, she will blink. And they will get up, they put a stamp on her desk, knowing she's a disability person. She went, 85 questions. Her name Leah, pretty as pretty can be. Now, Leah want baby, Leah want to get married. I tell Leah because this disease, there's good day, there's bad day. Remission and exaggeration. Pregnant, you can have a bad day. And the reason she had a bad day at NCLEX because studying was very stressful for her. Because it is a disability and you get a card and you get a bracelet. Because she can easily come in here and go into a respiratory distress. Anytime she felt a mama, papa, I didn't get mad because I didn't want her to stop breathing because of me. Or she went, I'm just making fun. Yeah, but she did just fine. She went in PAD. So even people with disability go in PAD. Right? So what's our issue? All right. Any question with Myasthenia gravis? I told you the disease, the medication, plus intervention, the intervention. Which test we will do here? Tensilin, but remember this is a neuro disease. Lumbar puncture, and what else? EEG. And this person will be positive for Babinski. Yes, they will. Guys, anytime it's a neuro disease, you remember her, we had to see if she had it. Yes, they will use Tensilin test, but they will do other tests too. EEG, lumbar puncture, or Gunsa. Okay? Any question? Any question? We cool? Clearly understood. I could tell when y'all understand because the room is quiet. Yeah.
columns, they'll be positive with both on Kearney's and the
99.9, no, not Paul Kearney.
just the
Hey, Kerning, Berdinsky is for meningitis. Babinski is 99.9 with all neuro. Brzezinski, Babinski, pas même. Babinski, ça come back. Le Lodi Kerning, Brzezinski, Wabzi, meningitis. Hey, it's what she asked. Do you know that student problem? Let me show you so it won't be of your problem. Right? If we say Brzezinski, right? If I spell it right, and Kerning, that is
meningitis.
Babinski is all neuro issue. All neuro issue. It can be Guillain-Barré, MS, it could be any neuro disease. Babinski. But Brzezinski, Kerning, on page 813, remember in that box, is only for meningitis. And that she not the only one student do that a lot because the B. Okay? Any question? That was a good question. Then we go to 825. Okay? 825. 825. We're going to go a disease called MS. Multiple sclerosis. Multiple sclerosis, right? I'm going to clear the board. Okay? Montel William had this. Put Montel William. Because when you put little names, you change, you remember, right? Okay? So Montel William had this. Osborne's son. Remember Osborne's son? The one with Dancing with the Stars? He was on Dancing with the Stars. My landlord had this, but he showing up, he coming to get that money, though. He dragged right on in here. Son, right? All right. So this is genetic. I'll rewrite the calendar.
That's what you remember.
No, Montel William ain't died.
No,
He's still here. He don't have to show no more. He just sell juicers and promote pot.
Yes.
Promote marijuana.
Oh.
Right? So, let's go. What is MS? Right? MS is a muscle weakness. Right? Right? So, let me separate them for you so you can have them in your mind. Right? When I met you, I did GB with the neurons, the myelin sheath, goes to blood. So you have muscle weakness, right? Guillain-Barré from feet to chest. The myelin sheath, demyelinized goes to the blood. That's GB. MG, I'll move. MG, here's the neurons. But the problem is not not with myelin sheath, but is with the junction that is producing too much chlorinase and little anti-chlorinase. That's MG, where him diviseo nice. MS, here's the neuron, Montel William. The problem is the myelin sheath is being demyelinized, déplimé. But it's not going to the blood. Here, it is demyelinizing, but it goes to the blood. That's why this patient have weakness plus kidney. Here, this patient, it is demyelinizing and it's just demyelinizing. It's not going to the blood. It's only destroying, but not going in blood. And the muscle weakness here, MG, is head to chest. MG. MS, head to toe. I'll leave this on the board. You can take a picture. So this one is head to toe. This one is head to chest. Guillain-Barré is feet to chest. But the problem is different reason. Yes?
With the MG,
Can you read that?
with the MG too much choline, whatever, and
Too-
little what?
MG, too much chlorinase and little anti-chlorinase. And that is the drug you're going to give them. MS, the myelin sheath that covers the neurons, is being destroyed, demyelinizing. And it causes muscle weakness from head to toe. All of these diseases, you will eventually die. When? Not tomorrow. But you will eventually, when they say degenerative disease, NCLEX will never ask you a DNR question on here. They normally ask DNR question on ALS, some type of cancer, something you're going to die from. You don't die from this tomorrow. You can live to about 50, 60, hell, 80. Before you die from getting hit by a car, right? So remember that. I gave something very, very important. Now, here, that's where we at now. Montel William had this disease. This is genetic. Men and women equally have it. At what age you will see it? In the 20s. Not 18, 25, 27. Sometimes 40s too, but you'll see it middle age. If I say muscle weakness from head to toe, let's start head, eyes. So you see the first thing the patient have eye problem. The patient have chewing problem. They can have it all at the same time. The patient cannot feel, right? So you don't want Montel to stick his hand in the hot water. You want him to use his elbow because he had peripheral neuropathy. The patient Ding, ding, ding. No good. Hard poo-poo. That's why Montel got a straight cap. There go the phones again. So you at risk for latex allergy, which can put you in anaphylactic shock because you straight capping yourself all the time. Now, you a man, and I don't want people to say, men get it more than women, equally. Now, remember Miss Sonia told you there's remission, exaggeration, right? You can feel better, and then you can feel worse. What will cause it to exaggerate? Worse, stress. Hot climate, cold climate. What I mean by that, extreme temperatures like you live in Florida, which is really hot, right? Very hot. Staying here for a long time, you can go into a crisis. Being in a cold place, you can be in crisis. So you got to make sure you live in a state where it's not too hot and where it's not too cold. Pregnancy can cause you to go into a crisis. Menses, period, can make you go into crisis. Any question? This is genetics. Men and women get it equally. Now, when you have this, Montel can have problem with eyes, problem with chewing, problem with walking. Late sign. Why do Montel go into respiratory? Let me explain to you. The disease don't cause Montel to have respiratory problem right away. This is not myasthenia gravis. Montel, Richard Pryor, died from this. Montel no longer can walk, right? So now Montel sits in a wheelchair. What eat Montel? Ulcers and pneumonia. That's how he ended up dying of respiratory distress. So on a test, I ask you a question about MS. You put respiratory failure, I need to give you 10 zeros because it don't make sense. Myasthenia gravis, you give me respiratory, it makes sense. I told you Montel, the only way he's going to die of respiratory failure is when he stops walking, he sits in the wheelchair, pneumonia take over. Just like Alzheimer's. Alzheimer's patient don't die of Alzheimer's. When they no longer can walk, they sit in a wheelchair, what do they end up dying from? Pneumonia. Any question? Yes.
Sonia, on number 3,
Uh-huh.
it says that the causes are known and that the disease is thought to be a result of autoimmune response to viral.
Yeah, what they mean, body attacking itself. When we get to immune, like lupus,
Right.
yes,
So
they
it's
think.
not genetic?
It is genetic. It is. When your mama have it, 99.9 you have it. And also, they think it has to do with autoimmune, the body not recognizing cells like lupus patient. It is genetic. I told you guys, my landlord had it. His dad had it. His dad had it. His cousin had it. They're all white male. His dad had it. His cousin had it. Little cousin had it, and he got it. Straight family. Yes. MS. Eventually, MS is from head to toe, but it's slow. Montel could live to about 70. It will never attack the respiratory like myasthenia gravis will. Pied, it is from head to toe, but you will see eye problem. Pied affects more. Late sign, because he no longer can walk. That's where the respiratory kick in.
But he could live that much because of the medicine he's taking.
Let me explain about, we're going to talk about the medication. Okay, and we're gonna talk about the medication in a minute. Yes, ma'am. Question?
Yeah, the PT and OT can do anything.
No way, parlez de ça. Think about what PT and OT. First of all, he don't have an OT problem. OT make a special spoon for you. That's not his problem. His problem is muscle weakness, so more PT. OT mean I lost my arm, and now you're going to teach me how to make some tools for me. So we'll work with that. Now, my lady say, well, medication's going to make him live longer. My darling say, physical therapy, guys, those are manageable. Mla. But eventually, I will go. And I'm telling you, once you a male, and this don't work no more, you either gonna drink or commit suicide. So he got a lot of mental thing going on. So let's talk what we gonna do for Montel. Right? Now, since it's neuro, you gonna do lumbar puncture, and in the lumbar puncture, you're gonna find protein. We're going to do an EEG for Montel, and Montel will be positive for Babinski. Remember? Shh, guys, come on. Right? Now, sign and symptom, fatigue, weakness, blurred vision, nystagmus, dysphagia, decreased perception, bladder problem, urgency, abnormal reflex, right? Intervention, bed rest, because he's fatigued. Now, Montel is fatigued and weak. What exercise you want Montel to lose weight? You want him to do aerobics. Aerobics help with strength. Place an eye patch on Montel because his eyes is what? Weak. Encourage independence because you cannot do everything for Montel. You're going to teach Montel how to do his Foley. Because Montel straight. Guys, Montel don't have the urge to, he don't have the urge to poop. So you're going to have to give him a lot of enema. And you have fecal impaction. So you got to make sure Montel eating good. Right? That's why Montel don't eat meat. He's a vegan. He eat a lot of veggies. And he put it in a juicer. The reason Montel, these people take marijuana, because marijuana help with the pain, the nerve, right? These people take Neuron and things like that also because he don't have no feeling. Do you know if Montel put his hand on the stove hot, he won't feel. Yeah, see, you will commit suicide. This disease is terrible. Very, very. It ain't no disability, I'm telling you. It is a disability, but it's manageable. Told you my landlord, watch when he come here. So, I came for check. I said, okay. I thought you sick. Yes. Ground to brain.
No, it's for.
But it is. Say it again.
Yesterday,
You,
I remember,
you said
yes,
ground.
ground to brain.
Okay, so let's go.
It's stuck with our good.
Feet is where? Okay. I'm going to put brain just so you can see how it don't make sense. Watch. Feet to chest. By the time I get here, I'm dead. So where will it go to brain? So we going to erase this. Like, that's why literally you got to be careful with students because you got to watch as the instructor what you say because they take I understand what she said, but I also showed her why it don't make sense. Because, see, lately, fait la bête, vous n'en mourrez, c'est qui les paye number, they don't back there. So, now what's next?
Est-ce que vous avez dit, patient avec,
I'll translate.
avec MG-MS, they have a problem with the nerve also because you say if they cannot, they don't have any sensory,
Okay. So she trying to combine them. Watch this. Anytime you have neuro problem, Parkinson, Guillain-Barré, MS, MG, all of them have problems with sensory because it is a neuron problem or muscle weakness problem. You got what she said? Because seizure, neurologist. Myasthenia gravis, neurologist. MS, neurologist. Parkinson, neurologist. That is why all of them is neuro-related. And that has to do with sensory. Good question. Yes. Comprendre. They all. Diabetes, endocrinologist. Hypothyroid, endocrinologist. Hyperthyroid, endocrinologist. Parathyroid, endocrinologist. Thyroid storm, endocrinologist. Or one, it makes sense. A patient with thymus gland, neurologist. Issue because thymus gland related to what? Yes. Good job. I comprend. Yes.
And all those go to autoimmune disease too, right?
Autoimmune disease. Good question. Infection control doctor. AIDS. Lupus. Right? And believe it or not, asthma has to do with hypersensitivity. So you will see infection control doctor. Now, side effect of asthma, you see a respiratory difficulty breathing. But the cause, you will see an infection control doctor. HIV, lupus, latex allergy, Claritin. You know you can give patient. Well, first of all, asthma is a respiratory distress. Claritin is a histamine. Sometimes you do not want to give the patient with asthma when they having wheezing. You don't want to give them Claritin because the Claritin will cause them to wheeze more. But if I want to know what caused the asthma, if it's mold, is it this, is it that, I can give you the Claritin. Do you? Because Claritin is used for allergies. Asthma, allergies are related. Go run. Now be careful. Miss Sonia didn't say. When patient having asthma attack, wait, make Claritin, because it's an antihistamine, will make the patient wheeze more. But if I want to know, the patient come in the room itching, hey, ooh, I can give the patient Claritin. Soon as the patient, hey, Claritin, hey, what you gonna give? Any question? Yes.
How does it work in pregnant people?
Patient with MS will have a separation because being pregnant is a distress to the body. About pregnant woman, you're toujours malade. Even low formé, you moody, menses. You're not the same person for the whole week. You real bitch. Oh, you one day you happy, one day you sad. All these hormonal changes. when the body go into distress like that, you go into exaggeration. You see the person cannot see. They got issues.
Does that affect the baby?
It does not affect the baby. It does not affect the baby. There's a lot of people who have MS and have kids, but you got to be careful. The medication may affect the baby, because we're going to go over the medication that they're on. Yes.
If a pregnant woman, like when she goes into labor and she's having an exacerbation, will she still be able to deliver vaginally, like with contractions and all that?
If she
Is that a
having an
problem?
exacerbation, okay, anytime you going into labor, although you have muscle weakness, right? If you can push, we want you to push.
But the contractions will still be strong.
The contraction will be strong, just as normal as a normal pregnant woman, unless the doctor, the muscle weakness is so bad that the lady will not be able to push. The doctor may have to do a C-section. But if you can push, you will push. We want you to push, do vaginal, then do C-section. There are more risk. Okay? Any question? Can we continue?
Yes.
Okay. Now, MS, so we talked about what the patient can have, the sign and symptoms. Then we're going to go to page 826, right? Box 5620. Now look at all these medication, what the patient on. And this is a disability. You will get a card. You will also get a Medi Alert bracelet. So let's go over the medication. Baclofen. Where did I teach you that? MS, MS, multiskeletal, right? This for muscle spasm. Do you see why Montel need this? Okay. But then the call, right? You see that? Help with muscle spasm. I mean urinary retention. Because Montel cannot what? Guys, he don't have the urge to don't have or poop. Things that we take for granted can't do. Yes.
You still happen right away or it's
Bonjour. Let me get progresses. Then first he'll come in 1 week and say, my eyes. Oh, my eyes. Keep moving. Then he'll say, I can't feel my hand. Then he say, I can't walk. Like pieces by pieces. Now look there. Every week you come in with a problem, right there the doctor will do blood work. First you go see a regular doctor. Then the doctor will order a neurologist for you. Okay? Right? Okay? So ready? Tegretol for what? Do Montel have seizure? So why you say Tegretol is a seizure medication, but Miss Sonia ain't never tell you Montel have seizure. Neurontin, Tegretol are used for what? Which is a what? Neuropathy. Come on. Neuropathy. The pain, the spasm. See, guys, Montel don't have seizures. So do you see why these drugs used for other stuff? Right? Now, then we go to steroids. Why? Inflammation. You see that? Because when you have this disease, we don't know where he got it from. So the doctors start giving him dose pack. They give him all sort of stuff. And let me tell you what steroids is. A lot of guys, you use steroids for everything. Steroids is, you know how sometimes you don't feel good? You don't feel good. everything hurt. But there's no blood test can tell you what's wrong with you. So you come to the ER, they do blood work, they don't find nothing. They do this, they x-ray, they don't find nothing. But you just don't feel good. The doctor gives you one prednisone. You up and going. So steroid is given for lungs, for heart, for anything. It attacks every piece of cell in your body and reduce any inflammation. That they call steroid the oldest drug in the world. So cheap, real cheap, but so good. But give you a lot of problems. What problem? When you eat all steroids and with zone, prednisone, betamethasone, zone. Anytime you have a zone, these are your problems. Ready? Infection, high sugar, high bleeding, not potassium. Yes, low calcium, low calcium, weight gain. Right? So they go NCLEX. Let me show you what I get you. NCLEX asks you, you have one room. Which patient you gonna put in that room? Do you see why we can put Montel in that room?
Yeah.
You know what you say to me? Oh, Miss Sonia, some Montel again. He only got MS. You're not putting Montel in the room because of this. You put in Montel in. You put in him in the room because of this. Anytime the patient's on steroid, you must isolate him. So, you see where NCLEX gets you? Guys, you see if you really don't comprehend. And what I'm trying to tell y'all on a serious tip, no joke. That's what I'm saying, guys. If y'all don't go deep and comprehend what y'all doing, you see how you can speak a whole lot of damn English and still going fail because of stuff like this. Look how pretty I did MS. Everybody know MS. Oh, I don't care. Give me NCLEX, MS, muscle weakness, Soon as we go through with steroid, boop, they get you. And the way they do it is, you got one single room. You got COPD, a patient with AIDS, MS patient. Do you know y'all take the AIDS patient? You see, you're not wrong, but you're not right either. Right when you, just because, all because you see AIDS. You see, you go, boop, you take it. No, but you see, but you left Montel here. But you say, well, Montel muscle weakness, Miss Sonia, that don't have nothing with infection. But hell, it's the what? Drug. Which one, baby? Stack over the counter? No, mommy. Prescription. And do you know how you can, you see, when we did respiratory, we give steroid. When we do immune, we give steroids. See, anytime a person is on steroid, you ask them, why are you taking it? For what? Because you can give it. Remember I told you, steroid is given when I don't know. I can't find out what's wrong with Lucy. And they would never give you 30 steroids, 30 pills. You go in the ER, doctor will give you 3 days. And I guarantee you feel good as I don't know what. Ooh, you feel good. They will never give you 15. The most, it depends on who, 7. And you can only take 1 a day. Even psoriasis, you put steroids, the cream. And when you put steroids, because I have psoriasis, and I use the steroid, I used to, and the students say, Miss Sonia, you bleaching. Baby, that's the steroid, so I take it and put it all over my body. Because it make you relax, as I don't know what. Because what it do, it makes certain part. Hell, so, but it burns. It burns. So hell, I use it all over. And the students said, oh, Miss Sonia, I want to clear show. Yes.
You're black fully.
Who will be on steroids for their life? Hypothyroid? Hypothyroid? Prednisone? Is Oprah on prednisone? What is Oprah on? Synthroid. I have hypothyroidism. I take Synthroid. What it is what happened, your T3, T4 not producing. You take it for you. It don't do nothing like because it's a plant. It's a plant. Yes, it's a plant that you take, right? You can give, if, for example, you decide to have a baby, we can increase your Synthroid. And we'll talk about that in endocrine. Okay? Any question? Newborn? Going down, immune suppressed. Hey, yes.
Question. About the Synthroid, do you have to take it for life?
Synthroid, you take it for life. I take 1 pill a day, every day. That's why sometimes I come here hot, cold, right?
So another question I have, assuming you have a patient with this case,
Which case?
the MS
MS.
and CD and CD patients.
GB.
No, another case. Another CD.
CD.
Yeah.
So, I know where you're going. Give it to me good, so it can come out good. So we have a CD patient.
And then this patient.
Which one though? Guillain-Barré. MS patient.
And tuberculosis.
TB patient.
So which one do you have to put?
That's the NCLEX question, right?
Yeah.
All right, let me give it to you. Watch this. Well, one, they ask you which one you will remove out the room, right?
Because I have a question like that.
I know you had a question. Listen, old student, help me out. So she went to NCLEX and they gave her 4 patients. And they asked her which one you will separate, put in the empty room. Right?
Yes.
Put in the room by themselves. Ready? A, TB patient. Put your thinking cap on. Cap on. B, C, diff.
Yes, ma'am.
C, MS. Hugs ya. And what was it? The other one didn't make sense. All right. Now, stay with me. NCLEX asks her, which patient she going to put alone? Now, we're going to go from the bottom to top.
Oh, okay. Excuse me, ma'am. Can we make the 4th one cancer patient?
Cancer patient. Oh, yes, God. Oh, I love it. Okay. I go to NCLEX. So you go, Miss Sonia. You say, this is a med-surg question. You know that. So you put med-surg. Cancer is not bad unless the patient on chemo. Take out. If they would have put on chemo, question mark. Take that out. MS can be in the room unless he's on what? C. diff is contact.
Yep.
TB. Stay with me. Miss Sonia said, TB. If I have it here, Michelle all the way in the break room Miss Sonia, in Fundamental Infection Control, page 141, says, TB, you never cold heart. So I'm going to prove
That's it.
What do they call that, the pressure? Miss Sonia, what do they call that room, the pressure? The room that you put the TB patient in? The negative pressure?
Look, Mom, I ain't trying to knock nobody. Shh. But do you believe an NCLEX junkie student go NCLEX and get this question wrong? I'm going to my student, this here to you is a level 1. Yesterday, you will know, but today, you know.
As you know, you know.
I will come out that computer with a win. My student, baby, this is a level 1 for us who walk through that door.
The question I had was, I wanted to know, I think it's like they said the wound they use for TB patient, is it only for TB patient? Because sometimes they just put, like, if you have a patient, and I forgot
the negative pressure.
The negative pressure.
The negative pressure is designed only for TB, and I'm going to tell you why. If Susan have TB, and I'm taking her to MRI, Susan, in the room, there has to be a window so air can go out. So I'm going to wear N95 in the room. Going outside, I'm going to take off my N95 and Susan going to wear a regular because there's too much air. Too much air. Yes.
Let's say we remove TB from there. Which one would you do?
If TB wasn't there,
Not something else.
if TB wasn't there, it would have been big. Okay. All right. So guys, it's 10:50. I have to stop because I have a board of nurses. For 4 Fridays, I will have a meeting with them from 11 to 11:30 when I join in. So Thursdays.